In this video, we'll discuss a few important points pertaining to local anesthetic agents dosages, right? So local anesthesia dosages vary in children as well as in adults. In children, in order to calculate the maximum safest LA dose, we have a formula given by Clark's formula or Clark's rule, according to which the maximum pediatric dosage of LA is equivalent to weight of child in lbs divided by 150 into maximum safest dose that's given for adults, right? So that's how we can calculate the safest dose of local anesthesia for children based on their weight and based on the maximum safest dose that can be given for adults, right? So in case of adults, the maximum safest dose that can be given depends upon various factors. First of all, when I say adult, the average weight of the adult is taken as around 70 kgs or 150 lbs. So when I say that maximum dose is, for example, X, that X denotes maximum dose for an adult who is 70 kgs in weight or 150 lbs. So we have a conversion here. 1 lb is equal to 1 lb or 1 pound, both are same, right? So 1 lb is equal to 0.454 kg, or 1 kg is equal to 2.2 lbs, right? Just keep that in mind. Okay, now coming to various local anesthetic agents and their maximum safest doses permissible to be given in an adult patient, right? Now let's look at few local anesthetic agents, 2% lidocaine and 2% lidocaine with 1:1 lakh epinephrine. Their concentration in cartridge, the maximum doses that can be given per kg body weight in case of adults, and the maximum doses that can be given to one individual, right? So coming to 2% lidocaine. So first of all, the amount of lidocaine in milligrams that's present in a cartridge, it depends upon the volume of cartridge. So cartridge is a device which contains a local anesthetic solution. So the volume of one cartridge is approximately 1.8 ml or cc. Both are same. 1 cc is equal to 1 ml, right? So one cartridge has a volume of approximately 1.8 ml or cc. So when I say 2% lidocaine, it means, see, I'm writing down here, 2% lidocaine, which means 2 grams of lidocaine is present in 100 ml of solution. In other words, 2000 milligrams of lidocaine is present in 100 ml of local anesthetic solution, which means 20 milligrams of lidocaine is present in 1 ml of solution. So the concentration of lidocaine, when I say 2%, the concentration is 20 milligrams per ml or per cc, right? So 2% lidocaine contains 20 milligrams of lidocaine for every 1 ml. So let me write down here. So 20 milligrams of lidocaine is present in 1 ml. I'm writing down the same thing here. So 1.8 ml, which is nothing but a cartridge, right? The volume of a cartridge contains how much concentration of lidocaine, right? If you calculate this, 20 into 1.8 by 1, you will get a value of 36, right? So 2% lidocaine means 36 milligrams of lidocaine in 1.8 ml of solution or a cartridge, right? Because a cartridge contains a volume of 1.8 ml solution. Hope it's clear, right? And the maximum dose in milligrams per kg body weight is 4.5. So to a normal person, 4.5 milligrams per kg body weight can be safely administered to a given normal adult. So maximum doses in milligrams in an adult, in the sense we need to multiply this with 70 kgs, because as I mentioned previously, the average weight of an adult is considered as 70 kgs, right? So 4.5 into 70 gives approximately 300 milligrams, right? So 300 milligrams is the maximum dose of lignocaine, 2% lignocaine that can be safely administered to a normal adult, right? Hope it's clear. Now, coming to 2% lidocaine with 1:1 lakh epinephrine. So whether it contains epinephrine or not, the concentration of lidocaine remains the same because it is 2%. So the concentration of lidocaine in a cartridge is 36 milligrams. And coming to maximum dose, there is a variation here because since we are using epinephrine, the amount of lidocaine that can be administered to the patient can be increased, right? So it is 7 milligrams per kg body weight. The reason why we can increase the concentration of lidocaine when we are administering it along with epinephrine is, for that we need to understand the functions of epinephrine. So as you all know, epinephrine delays or decreases the absorption of lignocaine into systemic circulation, right? Therefore, decreases systemic toxicity of lignocaine or local anesthetic agent, and also in the process increases the duration of action of local anesthetic agent. And most importantly, epinephrine helps in achieving hemostasis, right? So these are some of the important functions of epinephrine, right? Helps in hemostasis, delays or decreases the absorption of lignocaine into systemic circulation, increases the duration of action of lignocaine or any local anesthetic agent, and since it delays the absorption of local anesthetic agent into the systemic circulation, it prevents or decreases the chance of systemic toxicity, right? So these are some of the important functions of epinephrine. So 2% lignocaine with 1:1 lakh epinephrine contains 36 milligrams of lignocaine per cartridge, and the maximum dose of lignocaine that can be administered to a patient when given along with epinephrine is 7. In the previous case it was only 4.5, and in case of a normal adult weighing 70 kgs or 150 lbs, it's approximately 500 milligrams, right? Hope it's clear. So 500 milligrams is the maximum amount of lignocaine along with epinephrine that can be given to a normal adult, right? And another important point here is epinephrine in a normal case scenario, the safest amount of epinephrine or vasoconstrictor that can be given to a normal patient is 0.2 milligrams, right? Whereas in case of cardiac patients, the safest amount that can be given to a cardiac patient is 0.04 milligrams. Just keep these values in mind. And before concluding, another important aspect here is, for you to answer any question, any calculation part pertaining to local anesthetic doses, you need to understand the composition and components of a cartridge. So as I mentioned before, one cartridge contains 1.8 ml of solution. So one cartridge of 2% lidocaine with 1:1 lakh epinephrine. Let me repeat this. One cartridge of 2% lidocaine with 1:1 lakh epinephrine contains 20 milligrams per cc concentration of lignocaine. And as I mentioned before, this cartridge contains 36 milligrams of lignocaine in total, and most importantly 0.018 milligrams of epinephrine, right? So each cartridge of 2% lignocaine with 1:1 lakh epinephrine contains 20 milligrams per ml concentration of lignocaine, 36 milligrams of lignocaine as a whole, and 0.018 milligrams of epinephrine. So if you can remember this value, if you can understand this, and based on this you can answer any calculation question pertaining to local anesthesia dosages, right? So to summarize, local anesthesia dosages vary from children to adults. In case of children, we have Clark's rule to calculate the safest amount of dose that can be given, which is equivalent to weight of child in lbs divided by 150 multiplied by maximum safest dose that can be given in case of adults, right? So as I said, In case of adults, the dose is calculated keeping in mind the average weight of an adult, which is approximately 150 lbs or 70 kg, and the conversion factor 1 lb is equal to 0.454 kg, or 1 kg is equal to 2.2 lbs, right? And each cartridge has a volume of 1.8 ml or 1.8 cc, and each cartridge contains 20 milligrams per cc concentration of lignocaine, 36 milligrams of lignocaine as a whole, and 0.018 milligrams of epinephrine, and 2% of lignocaine. 36 milligrams of lignocaine is present in each cartridge, and maximum dose of lignocaine that can be given per kg body weight is 4.5. With epinephrine, it is increased to 7 milligrams per kg body weight, and based on the average weight of an individual, of a normal adult, we can obtain the maximum safest dose that can be given to an adult, which is 300 milligrams in case of 2% lignocaine, and 500 milligrams in case of 2% lignocaine with 1:1 lakh epinephrine. And also remember, 500 milligrams of lignocaine is equivalent to approximately 13 cartridges. So as I said, each cartridge contains 36 milligrams of lignocaine. 500 will be approximately equal to 13 cartridges. So the maximum number of cartridges that can be administered, in the sense the LA in cartridges that can be administered to normal adult is 13 cartridges, right? So once you understand the calculation part, in the sense the composition of a cartridge and the concentration of lignocaine present in every ml, and the safest dose of lignocaine that can be given per kg body weight with and without epinephrine, then you can answer any question pertaining to this topic, right? Hope it's clear.